All right, hello, we're back, and today we're going to talk about a case as an example of how to treat neurodevelopmental concerns naturopathically. And I chose this case because it's pretty straightforward, and it's got a number of nice little elements. It's a really I'm not going to say I'd say it's a basic case for me. It's one of the ones that would be most of the kids in my practice are doing these treatments, and most of the questions I got from parents I would get all the time. So I thought that might be helpful. And then, of course, we'll do more complicated cases moving forward. I also had my Kono peer assessment, which wasn't that scary. Actually, I had a wonderful ND who did it. And I actually graduated with her. And so that was nice because it's something I think like I've never had before, and all that stuff with Kono I think could be a little bit stressful. So it's all redacted. I have to share it here. There we go. So this case, they came to me, I think this is the first one. Yes, it's AGL1. Okay, so this case came to me January 2022, and this little girl is 2 years old. And the reason I found this case really interesting was because these are not parents who ever would have found me without referral. These are really sort of mainstream folks. They're educators here in the Halton region. They, really lovely, not very familiar with naturopathic medicine. And so there was a lot of I guess what I'll term sort of naturopathic counseling. And I made a few notes too that I'm going to check in on at the end to make sure I've covered all the things that I thought of when I looked at this case. So they were worried about autism. The child had been diagnosed with speech delay. There was some sensory behaviors. And of course, everyone's terrified of the word autism, right? So I get to be in a very unique position of framing autism and often assuaging concerns. That's difficult because, especially for educators who have a certain view of autism, they may even have seen more people with autism than most naturopaths or most physicians. So let's say you have an educator who has experience with severely autistic people. I mean, they're going to be really, really upset with these delays because that's their perspective on autism. In this case, I think one of the parents had experience with high functioning kids with autism. So that was sort of their view or experience. So this one was really interesting because this was told to me as a, sort of as a negative. And I had the opportunity to start talking about autism from a different perspective. So I say, well, she has this behavior where if you're not engaged with her, she goes and throws stuff into the sink. And so I started laughing a little bit, not like, I said, that's funny because I feel like when kids can't communicate at age level, they still are very, what is the word? They're still really good at getting attention, right? Because children, they want attention. And if they can't get it verbally, they'll try to get through behavior. And so she didn't want her mom paying attention to other people. So she'd go throw something in the sink. And of course, the mom, the first thing she would do is get up and go engage with her. And it made me think of my son because we would take him to, like Walmart, and he'd walk in and he'd just knock everything off the shelf. And of course, then one of us would pick him up and take him out. And that's what he wanted. That's why he did it. So I sort of told her that story and started to frame this concept of presumed competence. And just because people have speech delay doesn't mean they're cognitively delayed. And to socialize, we need to be able to have enough power in our visual processing. So, this was a lot of me talking about a philosophy of treatment, right? Where we have delays that are medical. Autism itself is inflammatory. I believe very strongly the architecture in the brain in autism is different. They have longer neurons. They're more complicated. There's less pruning. So there's a lot of power in these brains. And so, of course, when the brain needs more power, it's more sensitive to not getting that power. And so that's a lot of what I talk about with these younger families, because I want them to really be on board for treating with the goal of recovery. And I think we've talked about this before, but a lot of naturopaths don't talk about this. They don't have experience with this. And my mentor, who I've talked a lot about in the last couple of weeks, because she's down in Florida, so I'd reached out because of the hurricane situation down there, and all is good with them, which is wonderful. And then I actually had a student from CCNM who had spent time with her, and so we were sort of going back and forth. But Dr. Buckley is amazing, and her and a few of the other docs, they really just said, like, if you're doing this, you have to do it properly. Like, it is not fair, and it isn't right, if you're going to be treating autism, not to set up children for recovery. And so that's why I think it's so important to have all of the resources, whether it's for me, I'm able to pull stories more from my personal world. I'm with my son's continuing consent. We can talk a little bit about, how he's doing now, which is a question a lot of people ask. Before Magnus really regressed, I would have talked about, Dr. Buckley's story, because she wrote a book about it. I had met her daughter, who was recovered. We had lunch. We had a lovely time. We're both nerds. We have an author we both love. So to be able to interact with a recovered person is really powerful. So you may not have those stories, but those stories are out there. There's a great book by Marsha Hines called I Know You're in There. She recovered her son. I think he's an astrophysicist, and he's quite vocal about biomedical. So it's, there's a lot of these stories out there. And I think we need to really understand that although this is not life, it's not a life-saving treatment in terms of being an acute life-saving treatment, but you are saving their life. And so if we don't sort of put that appropriate expectation for goals out, then they don't know what's possible. And it's interesting because most people you preceptor with, or naturopaths you talk to, they may have patients who are setting the bar too high. I have two problems. One, they set the bar too low. The other is they want this to be cured, and they want to erase what's happening. And so both of those conversations I have. So these parents had no idea what was possible with treatment. They were also very apprehensive. I do have the comprehensive intake form. Maybe I'll see, Krista, can you see if Sherry wouldn't mind printing that for me? And then we can quickly redact it and upload it. I should have done that, I forgot. But here's the interesting thing in terms of histories. Like, obviously the history we take is important, environmentally, immune, birth trauma, medications during pregnancy, labor and delivery. One of the first signs of mitochondrial weakness, as we've talked about, is latching issues at birth. Mitochondrial issues also can present as jaundice. So these are important factors to be discussing, but one of the things that almost always comes up is, what did I do to cause this? There are actually families who blame the mothers for the children's delays. That was not the case here, but there was this sort of like, we moved 4 times, and then I went back to work, and like, what was it that happened? So what I typically say here is, the medical literature is really clearly identifying that environmental toxins are causing neurodevelopmental delays. And there's thousands and thousands and thousands of toxins in the air, land, and water, and in our food. And people who have autism have those more powerful brains, so they're more sensitive to toxicity. And then when they have methylation impairments, they can't repair, right? So what's the difference between one child exposed to lead or mercury or pesticides or fire retardants or PCBs? One child can repair the damage, and another child may not be able to. And so that's where methylation ends up being epigenetic. And we know that parents of children diagnosed with autism also have methylation issues, and so do their grandparents. That's the research of Jill James down in the Arkansas Children's Research Institute.
Hey, Son, do you want this little girl's intake redacted?
I want her comprehensive email intake forms, because I didn't print those yet.
What's her name?
Well, I can't tell you. I gotta text you.
Want to text me her name, and then I could get it?
Yeah. I just asked you to do that.
But I don't know her name.
I mean, you're in the same clinic, and we share consent. So the other thing I'll say to families, and this is closer to the end of the first visit, but I'll say, like, your consent covers the naturopathic doctors in our clinic. If I happen to be not here on a plane, my sister would be the one typically responding to any concerns that are of a more urgent nature. And that's the other thing I do to sort of create a supportive care model is I tell them, like, if you have an issue, If your child's hyper, they don't sleep, they have diarrhea. This is not bad. If there's toxins in there, they come out. They're going to come out in a way that may make you feel worried. So call us, book a no charge phone call or email. If it's urgent, mark urgent in the subject line. And it's interesting because the clearer I am with how I can be helpful, the clearer the emails are. Where before it was like we'd get these hysterical sort of like over the top emails, or it's really streamlined now. I think between myself and the staff and my communication, we're setting expectations. We're talking about a step-by-step process. We're focusing on the step we're on. And then we're saying, if there's anything that pops up that's not going smoothly, let us know. And then I provide all my families with my manual, and I tell them the flow charts at the end talk about aggravations because they happen. I've had so many patients from other naturopaths who they start on supplements, the kid goes berserk, and they leave that naturopath and come to me. I mean, that's if you treat, the worst thing is nothing happens. I hope someone's told you that. If you treat something and something changes, even if it looks negative, at least you're in the right area. The example I give, and I'll even share this with families, I'll say, if you hurt your arm, you go to the doctor squeezes your arm. Does it hurt there? No. Does it hurt there? No. Oh yeah, that's where it hurt. Well, you found the place that's the problem. So use that information, whether it's getting worse on things like B12 or probiotics or diet, and try to take all the data clinically. And I think that's the problem I had as a younger practitioner, particularly with children with delays, because I felt so bad. Like my heart hurt. I knew to some extent how emotionally how hard it was for families. And so I didn't use my brain as much as I could have. And so then once I started taking these reactions more as data, we had an incredibly successful journey, sort of using SNPs and using physiology and biochemistry to figure out, well, why would B12 cause tics? Why would, and typically it's the fecal loading, which we've talked a lot about. So
I can't find her comprehensive intake. Is it in?
It's in the timeline. So if you go into hers and then you go into timeline, then you just go down to the bottom.
Thank you. Thank you.
We use charm totally differently. So when she's using her soap form or whatever, I'm like, I don't like it. I don't know. I don't like yours either.
You're the worst.
I'm
on it.
I don't hesitate to recommend B12 in a first visit. I typically will show them this book, or I will give them the pages that we have scanned and saved on page 256. Basically, what it says in this book is what I tell every parent. Every parent who has a child with autism or suspected autism should consider methyl B12 injections because of the profound changes you can see in communication and social interaction. So that is a great resource because he's a pediatrician. My job is not to convince people to fall in love with naturopathic medicine, at least as I perceive it. So I have a lot of resources from neurologists. If I'm on Zoom with them, I'm pulling them up and showing them. I don't have the Autism Revolution here, but I that's one I often show. And so, they don't know this research exists. They're asking an alternative practitioner, and then you're like, inject your kid. So I need a lot of strategies to get them thinking about it, and they don't always do it in the first visit. I don't think they ended up doing this in the first visit. I went with a better tasting fish oil. Again, very new to supplements. Didn't think they were going to get the cod liver oil in. There's a lot of concerns about vitamin A. So I always do the math. So, and spiels, right? You get your spiels, write them down, or blurbs. So my vitamin A blurb is, vitamin A is theoretically toxic. It is fat soluble. However, there is a weight-based dose that if you stay under, there is no risk of toxicity. That dose is 4,000 international units per kilogram. What's your child's weight? Or I have it on the form, and I put it, into the conversation. Do not exceed this amount. Sometimes I put it in the protocol, but I address these concerns before they come back to us with them, because then that also creates trust. I talk a lot about diet. I have a lot of different analogies for diet, but that's when I show them the Martha Herbert book, The Autism Revolution. And she's a pediatric neurologist at Harvard. This is how she thinks you can improve the lives of people with autism. So if someone on this level, in terms of, she's a really phenomenal researcher. She has all kinds of papers. she thinks it can help your kid, why wouldn't you try? And that's also what I recommend when they're talking to family members, because if it's a intergenerational home or they have family members involved in the child of the care or in the care of the child, then I say to them, like, don't fight about food. Don't tell grandma her pasta's awful, or don't tell, grandpa rice is bad for you, because that gets into food dialogue with people that is not helpful. So I say, buy a Martha Herbert book, stick in your bag or your purse. And if someone asks you why you're doing it, you say, well, we're trying this diet because she's a pediatric neurologist from Harvard, right? It has nothing to do with your diet or anyone else's diet, because people get really emotional about diet. And I can't remember if this family or not, it might have been, but we had a family recently where they thought it was child abuse, the grandparents. Like they thought it was actually child abuse to be injecting and putting the child on the diet. And that is not the first time I've had that. So in my intake form, I also have, do both parents consent to care? That's a big one, because 80% of parents with kids with autism get divorced. So we do not want to end up in, courts and all that junk, which we just avoid like the plague. That's why we put that in our intake forms. I ask them what they eat so I can help them. I cook a lot. I spend a lot of time in my kitchen. And so I cook in a lot of different types of food. So if they have, say, if they're Italian or they're East Indian or Chinese, like I have a lot of, information on how you could shift those diets. So in here, here's some suggestions. And then for people who really struggle, I will send them the handout, Transition to the Paleo Diet. So I'll put that in my notes to bring up later. So I'm going to show you the Martha Herbert book in a minute, and then I'm going to show you my Transition to Paleo. And Transition to Paleo is great for your families who aren't quite there. I suppose I can just bring it up now. It's not the end of the world. But I have handouts for a lot of stuff, and I have blurbs for everything. I do say, a lot of times I say the same thing every day. I say the same thing all day long. I don't mind that. That's what I've chosen for my practice, to be very focused. If you don't have a focused practice, you're not going to have as many sort of blurbs as I do probably, but this is what I'll put in if there's suspected autism or autism. This is the book. This is the documentary, or, Magic Pill, which follows a little girl with autism with severe seizures and quite significant autism symptoms. And then they put her on the modified ketogenic diet and she improves. So it looks like I've updated this handout even from that, January. The handouts, you can have any of our handouts, like, bring a flash drive, ask, you can have them all, modify them all. They used to do that at CCNM. I'm not sure if they still do, but it's awesome. And this was just my take on how you would transition. I use the Transition to Paleo a lot for my ADHD families. They do not feel, usually they don't feel ready just to jump in. Once in a while you get lucky where a parent's done paleo and they're like, oh my gosh, my brain feels so much better. I feel better. I have more energy. And I'm like, yeah, that's what it's going to happen to your child. I think one of the biggest things in treatment is you stick to your plan. I don't think it's bad to be flexible, and I don't think it's bad to change your plan if parents say, well, I can't do that. But what I often say to them is, this is plan A. This is the best plan I have for, your goals for your child, whether it's communication or reducing autism symptoms or, progressing on the path towards recovery. So this is plan A. If you don't want or are not ready for plan A, please let me know, book a no charge call. I'll let you know plan B, C, D, but I would not be doing my job if I didn't tell you plan A was the best thing to consider for your child. I do a lot more testing now. I go through periods of time. I did a ton of testing in the beginning of my practice, and then I stopped doing as much testing. Testing is a great way for people to be having more control in their treatment, because they're actually, I don't think I'll continue to share it, but here we go. I don't know if you guys have seen the Great Plains test. We will definitely do, a whole thing on this, but this is great because, say for something with the diet, you're talking about why diet's important, and the parents say, oh, I heard yeast could be involved with autism. So then you can say, oh, we can test yeast. This will test 48 strains of yeast and fungus. It will test 22 strains of Clostridia. I'll often then tell them about Derek McFabe and how he reversed the brain inflammation in the animal model by taking out the carbohydrates. So whatever they come in knowing, you can then talk about testing to confirm or assess. And that's a great approach to treatment. Krista does a lot. She does it a lot better than I do. Oops. I'm sorry, I'm just bringing her little thing back up here, but I think I'm actually done the first visit. So any questions about first visit strategies or what that first visit looked like to you guys? So so this one is, so sometimes when I was first using Charm, I would like hit duplicate or whatever, and then it would come up the same. So some of the stuff early on in the pandemic, or even this is a year into the pandemic, I'm still sort of like getting my Charm legs up and running, which I only realized because of the peer assessment. And that's why I think with the peer assessment, it was good because I could definitely chart better. I rely pretty heavily on my memory. I have a really good memory, but you know, I'm getting older, so that probably has to be beefed up by more information here, particularly if I was going to pass this chart on to someone else. This visit was really just counseling. It was naturopathic counseling because we talked about their fears and their apprehension. One of the other reasons that I chose this particular case was this this family was really hesitant. I find with little girls, and maybe I do know because I feel I'm almost like this with my daughter, but the little girls, parents of little girls, I find for the most part are way more hesitant and way more nervous about treatment than parents of little boys. And I'll ask Krista when she comes back. I found that fascinating, but I can say that when my own daughter started to need supplements, I was very different about the way I approached supplements with her. So with my older son, it was like, do it or there's no screens, like, and don't complain. I was like, you take your supplements, you don't complain, and then you can play Skylanders. And if a week goes by and we get through the week, then you get a little Skylander figurine for the, you know, they play video games with them, but you may know. But so that's the way I approached it with my older son. My younger son with autism, you know, a lot of the kids with autism were pretty compliant. It's somewhat sad, but we just did it. It was like, this is your medicine. You have to take it, you know, whether you're crying or upset. But then when my daughter had started taking supplements, I was quite the wimp. So it's interesting to have sort of gone through that. But I don't know how much we're really going to glean here beyond. We really talked about this methyl B12 safety. Why would we be injecting children who are so young? You know, how do we go about injecting? And then it's this, I have some resources that I've put together, like this is parents in our area sharing their success with biomedical treatment. And they talk about biomedical, they talk about diet, naturopathic treatment, B12 injections, things like probiotics. They don't mention my name. They are our families, but they don't mention our name. So I send this along because often parents need to hear from other parents. There are times where I have done mentoring, like I've actually said, why don't you go talk to this parent? I do less of that now. I also have a video that I can show them now that we're not in office. It's a video of how you would inject. It's really scary to inject the first time.
Hi, I'm Dr. Sonia.
I don't know if you can hear that. I don't want it to be so loud. Give me 1 second. I'm going to mute me for 1 second. Let me see if I can get this. Yeah, so I think the video is really small. So what I'm going to do is I'm going to put it either in the chat or I'll send it to Erin and she can make sure you guys have it. So this video is just how you would help parents inject. We just have parents kind of have their kids in between their knees. And I'm right-handed, right? Or sorry, I'm left-handed, but most people are right-handed. So they're going to actually stand looking at that wall so that you can actually lean them over your leg and wrap your hand kind of around the back. It's important to show them how to hold a child still and inject, because that's the hard part, is keeping children still, making sure they don't grab the needle. And then some parents do it when kids are sleeping. I'm going to send this to Aaron so you guys will see that video. It's just down at the bottom. So that was really the second visit. The third visit I'll pull up. I was just talking, Chris, about supplements with girls versus supplements with boys.
Oh, we got there. Maybe I'll read the video. I'll listen to the video after.
Well, I just found it's harder for parents of girls to give supplements. I found that for myself as well.
I think because they're so sweet sometimes. You're like, I don't want to hurt them. Whereas boys, you just sort of think they're tougher.
Yeah, it's interesting. I've been surprised by that in my practice. But okay, so this is visit 3. This is March. So remember, we started in January. It's now March. So it's January 24th. So this is March 10th. So they've started treatment in earnest now. So now we have much more to sort of talk about. And parents are pretty surprised. Like it was very interesting because I don't think they were expecting anything. I think they were convinced that it was safe enough to try in the second visit. And they started it, and I think by the third visit, they were pretty surprised. Your patients are getting better when you don't have to prompt them. You get on the phone or they get in the office, they sit down, they start telling you stuff, right? That's a pretty good indicator things are improving. If they're not doing that, you should go back to your previous notes, maybe take them a little better than I did, and ask and compare. Because sometimes people are so emotionally stressed out, they don't realize something has improved, right? So I'll say, well, what about grinding the teeth? Oh yeah, they don't do that anymore. Okay, what about hitting? Oh yeah, no, they don't do it anymore. Running? No, they're calmer. Basically, what I hear when I hear that is they're not talking yet, right? Because they've got the one goal. Typically, when that happens, it's the one goal of language, and you can have all the improvements in the world until the language starts. Some people are stuck in that, and I completely understand that. So at this point, she's responding to her name. They're noticing lots of positives. She can repeat things. She's saying hi. She started saying mommy. Pretty sure both mom and I cried at that. That's a big one. She was still throwing stuff in the sink. She was really happier, a lot happier. They put her in daycare. She wanted to play with her sister. She has an older sister. This SLP, we thought she was on the spectrum. So then again, I go back and talk about the spectrum piece, trying to say, like, we don't need to be afraid of autism. We're not afraid of asthma, right? Well, we are, but I mean, we treat it. It's an inflammatory disorder. We treat it. So just like eczema, just like asthma. The scary part of autism is when you don't treat it. Particularly at this age, I'm not having these conversations with parents of 20 and 30-year-olds, but 2-year-olds, yeah, that's what Dr. Buckley, my one of my favorite docs, she says, I do my little happy dance. If they come in, they're under the age of 3, I do my happy dance, because as long as parents are able to comply, they're going to recover. So mom has started to sort of get her head around the autism piece. And mom and dad typically are on the phone together, but they're starting to think she is on the spectrum. She's high functioning, she's social, she's looking them in the eyes. And then we revisit the B12 piece. Typically, this is when parents ask, is there any other way to do this? If they don't ask already. So that's when I go through my spiel of B12 orally is 5% absorbed. Injection is 100% absorbed, but it's also the water soluble problem, right? So if you take B12, you urinate it out, the brain doesn't have time to get it. If you inject into the subcutaneous fat, it slowly releases over the course of 12 to 36 hours. So the brain can finally get enough of it, keeping in mind that all the organs and muscles want B12, so it's in high demand. I'll typically mention Richard Deith's research, and I say to them not to be gruesome, but when we have looked at, brain tissue in autism, there is very low B12 in the brain. And sometimes I send them that, not necessarily the study, but there's a Q&A with Richard Deith, and it's just talks about this B12 piece. I have a lot of focus on my home run treatments. I want them on these treatments. I want them getting better. And then as you can see, within not even, what is it, 6 weeks, January 24th to March, right? This kid's already on the road to recovery. So then I have lots of obstacles moving forward, which we'll see by the last visit. So things are going well pretty here. I'm always refocusing on the diet, always answering questions about the diet. And typically parents will say, well, how long do they have to do this for? I change that answer up. I don't always say the same answer. So visit 4 and 5 are pretty similar. This, it's so funny that when I really did a poor job charting here, which is not unusual. That's why it's great that I was peer reviewed. But
It's been 20 years. She didn't have too many issues with it, did she? Did she say you're a poor charter?
I didn't read the email yet. I know I didn't lose my license.
I mean, the EMR allows us to do most of the requirements for our charting.
Well, actually, and to be honest with you, the comprehensive forms that you have too are part of the way that I track info.
I'm working on them. I'm working on them. They're being redacted and then sent back, and I'll upload them so you can have them.
Nice. And we may not get to them today, but maybe it's a good follow-up. We can just send them and you can look through them. So then, the parents were really surprised how well she was doing, because at Christmas time, she was looking more severely autistic. Now she's loving playing games. She loves water. Again, this is a lot of counseling of this family. So I'm going to sort of jump ahead, because I know Krista wants to talk a little bit about immune stuff today, but I'll jump ahead. I just had an in-office visit with her. And this is what I find interesting. So in the course of, this visit was September. So in less than a year, this child goes from what the parents say is, more severe autism. Now they say it's high functioning autism. She's interacting with her parents. She's interacting with her sister. She's hugging, kissing her dad for the first time, all along the way. And so then they come into the office and she's been diagnosed. So we again revisit, what is autism? What does it look like? It's medical, different perspectives. I encourage them to read my manual or some of the books that talk about autism from a medical perspective and talk about recovery. And over the summer, her speech has exploded. She is a little repetitive, but there's been tremendous improvements. And then I'm watching her play in my office, and I see a lot of the squinting that she's doing. And they ask her questions, and then she doesn't answer, right away. And she does still seem a little bit off in her own world. And I have a whiteboard wall for anyone who's been here, so the kids can write on the wall with a whiteboard marker, and so she can't really hold it. So then the question is, well, how long do we have to do the diet? And I said, well, ideally till she's caught up, and recovery is really important, and you want to try to get kids recovered by grade 1, 2, 3, because socially they need time to catch up. Once their language catches up, they need time. Like they need enough time to get the social experience. And so I'm really saying, like, diet should be as strict as it. So of course it comes out they're not being strict with diet anymore. and then, I sort of talk about some of the things I'm seeing. Yes, it's wonderful how far she's come. It's really important that we treat the visual processing entirely, because any symptoms of visual processing means the brain is slower than it should be or could be. It's slower than we want it to be, and the brain could be faster, basically. And then I sort of correlate that with the slow language processing, keeping in mind that to treat autism, you have to entirely treat visual processing. So we'll get to that integration recognition stage where there's no problem with the vision. And then that's often when you get even further increases in language processing. Weak pencil grasp is a mitochondrial flag. So there's still work to do, right? The hardest year of treatment is the first year. And a lot of people stop before that. A lot of people stop at a year. Most people probably stop at 18 months to 2 years. And not all those kids are fully recovered. So we had this conversation where they thought she would be much more severely autistic had they not done all the interventions. And then I go, into more of the visual processing information. Cod liver oil. We have a cod liver oil handout that sort of does the math. And essentially cod liver oil is extremely high in omegas, and then obviously it has the vitamin A and D. So it also has the cis form of vitamin A, which is a better form for visual processing. And so I recommend starting to get this in and mixing it with her more yummy fish oil. I'm starting to suspect there's bowel backup. There wasn't major indications of that before, which is great, but keep in mind that B12 and fish oil will detoxify, so you'll eventually plug up the gut anyway. So they have plugged guts, they have bugs that make microbes, they have mucus that sticks to the gut wall. I had this happen the other day. This kid, his mom's calling me, he's crying in the background. She's like, I don't know what's going on. And he's constipated. He hasn't gone for 4 days, and they're about a year into treatment. This kid had low carnitine on blood work. So they put him on carnitine, and he did really well. His language started and he's doing really, really well. But then all of a sudden he got really constipated. It's because the carnitine allowed the fat to get into the cells, and then it started to take out the stuff that stuck to the gut wall. So it was pretty interesting. So they also get really plugged up in the rectum after all kinds of bowel work, all kinds of detoxification. You get downstream clogging in the rectal vault. I revisit the testing because I say, well, the best way to make decisions on diet is to know who's living in there, right? If you have high yeast, it's easier to commit to a diet without carbohydrates, complex carbohydrates, same thing with Clostridia. And so this is a great way to keep them. This is a big challenge in my practice, keep them treating. And I actually was a little bit surprised that they were ready to ease off because, I said, like, the sky's the limit. Once she's doing this well, you want her to get back up to age level. But diet is really, 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 really hard for a lot of families, particularly families that are quite social. We aren't. So we're a more insular family, as we've been told. So it was easy for us to maintain the diet. And of course, I think I knew also what was at stake, but we'll see. I don't know when this family is in next, but the couple of the guiding principles that I had thought of when I talked about this case were, I'm going to pull them up because we'll see how well I did in hitting them. Okay. I don't have language processing issues today. I just have like processing issues today. I'm so slow. So compared to last visit, this happens a lot in Chris's practice, right? Well, everything's the same. Okay, what about this? What about this? What about this? That's why I like my comprehensive email forms, which Krista will send after they're redacted. So you can see from visit to visit.
They're so hard to get out. Like the Sharpie's not working, and like they're having to white out on top. It's coming. It's a one job, man. I'm on it.
I think it's good though, because if you're interested in seeing the case in more comprehensive, like step by step for whatever forms they've filled out, because they don't fill it out every time. Compared to last visit, stick to your plan. The importance of naturopathic counseling, like this case would not have turned out the way it was unless I spent a lot of time and energy talking to families about safety, about philosophy of treatment, that we went at that a lot. And that's what made me think of this case as an interesting teaching teaching tool, I guess. The other thing is regular visits, right? You're not fixing autism in a day. So you need to talk to them about, I say to my families, after the first month of B12, we follow up at 4 to 5 weeks. And then I follow up every 2 to 3 months after that with my families. I do not prescribe B12 for longer than that. And then I get to be part of my patient's journey as they get better. I also can make sure, they're on a B complex, which was in the last one. Actually, that was the other part, B12 safety. B12 safety is excellent long-term. After B12 is working, they need to be on a B complex. And then ideally, you're transitioning them onto an autism-focused multivitamin, which is very high dose. But as you know, just B12 will then deplete things like folate and eventually B6. So they need to be on a B complex. They should be anyway, because there's lots of benefit from folate and B6 and B2 for mitochondria. And so then that conversation, we talk about how to get supplements in, treat it like a medicine. You can't heat it or fry it. You can freeze it. It could be at room temperature. You mix it in applesauce or juice or honey, jam. Oh, I thought they weren't supposed to have sugar. Oh, well, these are opportunities to use sugar to your advantage. First and then is a concept that children eventually learn: first medicine, then treat. Not all children know that, but you can talk about first and then. And then, we had to force supplements into our son, like literally force him to take them. I think you only do that when you know what's at stake. So I have lots of families who do that. I have families who cannot and won't do that. So in those cases, I'll put folate into the injections, and then we compound B6 from signature supplements. So it's 50 milligrams is actually 1/32nd of a teaspoon, because 1/4 teaspoon is 200, right? So then 100, 1/8 of a teaspoon is 100, and then 1/4 of an eighth, I think, is 32. That's 50 milligrams. So you can literally sprinkle it on, and yeah, that's so B6 is important. And if I can't get the other B vitamins in, that's how I approach it. You of course can't inject those because they burn. I think I covered all my principles. That's it. That's me. That's my case.
You want to stop recording and then we can like